First of all, thank you all for joining us today. This is the second in a series of ADA workshops being provided by Will Purvis with the Disability Network of Washtenaw Monroe Livingston. Will is the director for community outreach and engagement.
For accessibility and education.
All right, I've seen two different things. I think Will is
That's okay.
of all trades.
I did to your credit, I did switch titles earlier this year, so
All right, forgive me.
that's
Um,
okay.
so before we get started with this presentation, feel free to ask questions specifically around your clinics and your operations. And, and I would also like to add that I'm aware of the contractual delays. Please feel free to email me directly if you have not received a finalized contract or are unclear where we are in the process. Um, and my sincere apologies. In January, I had no idea that this would be so challenging to provide a few $1,000s to grantees via the University of Michigan. In the future, I'm aware of the pitfalls and dangers and will work to not have this repeated. So I'm going to share the slides and Will, you just let me know how to proceed. All right?
Great. Thank you, India. And welcome everyone. Uh, so the last time I know some of you were here, we talked about the ADA and sort of broad implications for medical and dental practices. And today we're going to dive into patient flow. Um, I think one of the things, like as India said, I really want to encourage questions because when it comes to patient flow, we're talking about a wide variety of different processes that all intersect in and around your clinic. These can be digital processes, these can be physical transportation, these can be how people move through your office, and also the ways in which your staff and contractors interact with those patients. So it's a really complicated topic. Um, and the presentation today will be probably more of an overview as has been offered in the past. And I'd like to reiterate it now. We are happy to work with any of you individually to talk about physical questions and other questions about how people use and interact and work in your individual settings. So this is our staff. For those of you who don't know, Disability Network is made up primarily of people with disabilities working for people with disabilities. And our particular office serves Washtenaw, Monroe, and Livingston counties. We have partner agencies serving every county in Michigan. So you can go to the next slide, India. So our mission is to empower the lives of people with disabilities and advocate for a more inclusive community for all. Next slide. So here's our agenda for today. So a little bit about who we are and how we think about disability. Then looking at sort of the different areas of patient flow, and then looking at some common access issues and some solutions. And then finally, sort of a look ahead to the next workshops. When it comes to the access issues and solutions, there's going to be a fair amount of overlap between them. So just be prepared for that there'll be some things that'll be repeated because they're things that work across a wide variety of different issues. Next slide. So a little bit about what Disability Network does, what we do, and our partner agencies do, we will offer a wide variety of different services for people with disabilities. Just about all of them are no cost. We do also do a lot of work with businesses and nonprofits on supporting accessibility and ADA regulations. We do site plan reviews. We consult on renovations, things like that as well. And that's one of my main roles. Uh, Next slide, please. So one of the things that we find useful is sort of thinking about what is a disability. Um, and according to the ADA, sort of the most common definition is a physical or mental impairment that substantially limits one or more major life activities. And typically, having a disability means that accommodations for various services, jobs, work environments, or the way things you usually do things are um, uh, can be granted or asked for in different situations. They don't always happen, but you can ask for them. Um, and many of you might know that in schools, these are generally defined under an IEP or a 504. In the workplace and government, they're defined by typically by HR policies and legal frameworks provided by the state and federal government. Um, next slide, please. So we also think about disabilities in terms of the kinds of potential barriers that folks may face. So the ADA definition is a medical model of disability, and we often find, especially when it comes to accessibility, thinking in terms of a social model of disability, so thinking about what kinds of things might get in the way or present a barrier for someone to access a service. So in general, so different kinds of disabilities, we find these useful because they can provide sort of a checklist, if you will, or a way to sort of look at the environment that you're working in or that you're interacting with um, clients and patients in. So how might these disabilities or kinds of disabilities sort of intersect with the kinds of things you're asking people to do or moving people through a situation? So I I find often with folks that we work with that sort of thinking about these kinds of things, uh, disabilities in this way provides a useful sort of lens in which to look at the world around you, your work world, the clinic world, um, and uh, try to think about how they might become different things in your environment might become barriers. So, um, next slide, please. All right, so now accessibility and patient flow. So, next slide, thank you. Um, so in general, sort of thinking about patient flow, um, there's a wide variety of different ways to kind of think about it, but the ways in which we've worked with folks in the past is sort of from that kind of initial awareness of the clinic, of you existing as a place for someone to get health care or dental care. And um, and then making that initial contact with you and um, there's going to be some form of intake. It might be someone just coming in off the street. It might be someone calling you. Um, it might be someone accessing through a web form or what have you. Um, and information is usually gathered. Some set of information is gathered at that time. Um, and then there's a visit. It might be an in-person visit, or it might be a telehealth visit. It might be a phone call. It's a wide variety of different things might happen during that, um, in that sort of category of space of time. Um, and then either during or after that visit, typically there's a communication to the patient um, of what the diagnosis is, what the care plan might be, what are the next steps to take care of whatever issue it is that they came in with. That might involve, um, it might be relatively straightforward, or it might involve coordination with other services, with other clinics, with hospitals, um, social services, other kinds of support networks. So it can be that can be very sort of complex and multifaceted part of patient flow. And then there's the discharge. Someone might just leave with a fairly straightforward set of instructions. But there also often is follow-up, continuity of care. Again, it really depends on the kind of case and the various things um, that have been presented. Um, so next slide. So looking at the awareness of the clinic, so we're going to go through each of these sort of in turn. Um, so how do people know you are there for them? And I know for um, this group, there are a couple of you that are working on accessible websites and upgrading your websites to make them accessible. So taking a look at those, I know some of you have taken a look at those already and said, yes, we need to work on these. Um, for others, that might be something that you still need to audit, but it's always a useful thing to check whether that sort of digital interface is up to the standards, and also how sort of the other side of that, or other part of that, is the other forms of outreach. Do people um, uh, with disabilities know that you have, if you are already providing some sort of accessible services, um, or you have an interest in providing accessible services, is that something that you're communicating? So, for a lot of folks with disabilities, this lack of accessibility is a pretty common issue. So making it clear that you do offer accessible services should be apparent and transparent. So what do you offer? Um, Outline any current barriers and how you can make things work for people. Um, so if you know you have a barrier, don't be afraid to let folks know about it. Like, we have 5 steps going up into our clinic. So if you're arriving in a wheelchair, then we're going to have to come up with a solution. Um, and then also working with, or advertising or networking with disability groups that you do serve. If you do feel like you do good work, solid work with particular kinds of disabilities, networking with those groups and those individuals can be a good way too of getting that word out. Next slide, please. Following this sort of awareness is that initial contact and intake. So one of the things that we sort of circle back to with a lot of different organizations is raising disability questions and access issues earlier in the process, that rather than later. So having questions on web forms that ask about accommodations, um, and ask them in an open-ended way so that people can um, uh, answer in a variety of ways. There's a lot of different kinds of accommodations and a lot of different kinds of access issues. So oftentimes having a checklist or a series of boxes um, doesn't, people may not see themselves in that list. So having the space um, to provide their own experience and to talk about their own experience with disability and with accessibility is important. Um, it's also important, we've found, to delineate um, access issues from medical issues. They may overlap, and they often do, but um, uh, asking about access issues specifically, um, uh, excuse me, separates it from um, asking about particular medical issues. Um, and then if you have those open-ended questions, or it's important to ask, are they going to come with a caregiver? And also, it's as we'll sort of see throughout this, and this was a highlight in the last presentation, is talking about and asking about communication needs. It's also um, helpful to ask them what has worked for them in the past. So if, what has worked for you in another clinic setting or in another visit. Um, and if someone says, well, I need this kind of thing, and you don't provide that, or you don't have it, then that might be a good time to ask yourselves, is this something we can provide? What might be the route to make this available for our clientele? Um, Next slide, please. Um, And in this cases, all of these cases, sort of things that might be needed would be training for the staff who perform intake functions. So how to ask, what to ask, how to include these in a reasonable way on web forms, how to protect privileged information, um, and how to ask these kinds of support questions. So making the space for those and revising your materials. And then sort of the mirror to this is doing an assessment of access barriers and areas of support. So these can be communicated clearly to patients and caregivers. And as you make changes in those things, to communicate those to your staff who are sort of at that front end, so that they know, oh, now we do have an adjustable exam table, or now we do have 3D models of gum disease, or whatever it might happen to be, so that we can meet more clearly and cleanly meet some of these access needs. It's also, I think, part of that training and thinking is to be honest with yourselves. What can't you provide? And thinking about, for patients that need different kinds of support or specialized support, where can your staff direct them? So having your staff able to, um, support people in their search for medical care that is accessible for them, um, that you can be part of that support network. Next slide, please. Any questions at this point? Thoughts?
For me, thank you.
Anything come up in chat, India?
Nothing in chat, but I would be interested in hearing from any of you all with an example of a real experience around accessibility and disability that has occurred in your clinic, if you're aware of one, and perhaps we could just talk it through for a minute.
As you were speaking, I reached out to our EMR coordinator and also our marketing director who manages our website and just asked, hey, are our digital interfaces accessible? It's a question for us to answer and kind of explore later. What does that look like?
Okay, we can make a note of that. I know we've recently at the center had some discussions around offering technical assistance or open office hours around accessibility. And once we get those together, I think it would be an opportunity for you all and any um, entities or agencies to pop on, and we would be happy to provide information, additional resources.
Perfect.
This is Will. Also, we can refer you to people if after you ask and you do have questions, we can also um, maybe answer some, but also refer you to other folks who might be able to provide more comprehensive support.
Thank you.
Thank you. Any other thoughts?
All right, this is Will again, so let's move on. So there's sort of two parts. So moving on to the visit itself. So once the patient is engaged with you, whether digitally or in person, there's sort of two big areas. One is the communication and potential communication barriers, and the other is sort of physical barriers. So communication issues, in our experience, can be a really significant barrier throughout patient flow, and we sort of talked about that a little bit, but it can become even sort of more critical in that conversation between the caregiver, the doctor, physician, nurse, whoever is doing um, that interaction, um, and then and the patient themselves. So what again, sort of doing that audit, sort of what kinds of communication support and assistance can you offer? What equipments and tools do you have at hand? Um, uh, what kinds of tools can you have that may need to be prearranged? So it might be a sign language interpreter or um, uh, something similar. How is that process set up? Is there a protocol for it? And um, what's the sort of speed that something like that can happen? Is training for staff from sort of the front desk intake point through the um, through the visit, is it up to date? Do people know sort of what materials you have, what tools you have, and how to use them effectively uh, to make um, again, sort of making space or time in your scheduling and to allow for communication to be more systematic or more deliberate for people who have communication issues. And this can be, we'll talk about this probably all the time, but, and we have this conversation a lot, is that having it, the way that medical practice and medical care is often structured is that time is probably the rarest of commodities, probably maybe after money, but um, having um, having that time and making that time in your schedule to allow for that communication um, can be um, something that's really valuable for accessibility, increasing accessibility um, throughout the visit. Um, and then again, sort of getting back to those points, asking if accommodations are needed. Um, will they come with a caregiver? What are the communication needs? What are they specifically? So that you can be as prepared as possible when someone comes in. And like I said, some of these things are going to pop up again. Um, Working with folks, asking what's been helpful in the past, and then um, can you offer that support once you find out what they need? Are there ways you can make it work and keep them as a patient or support them as a patient? Next slide, please. the other big side of accessibility is that physical access. And we talked a lot about this in the last workshop. So I'm not going to go into a lot of those details here, but I'd be happy to talk through any kind of physical access questions any of you might have as you go forward as grantees. And we're happy to arrange a visit or arrange with one of our partners to have a visit to come out and do a walkthrough of the clinic to look at those physical access questions. So returning to that checklist, you can do a walkthrough, like I said, with us, with yourself or by yourselves, checking what are the barrier-free routes, where are our larger exam rooms? Do we have any larger exam rooms? How many people can they accommodate if someone comes with if they're a wheelchair user and they come with a caregiver and a service dog, for instance? Do we have a room that can accommodate that number of people? How many and where are our accessible restrooms? What kind of adjustable equipment do we have? What kind of adjustable tables, exam rooms, and so forth do we have? Have we provided training for how to be a sighted guide or how to work with someone who's deaf or who's deaf-blind? How do we interact with service animals in our clinic? Do we have experience with that? And how do we interact with a patient who might be working with a caregiver, and how does that caregiver's presence and support intersect with the person with the disability, with the patient? And again, same 3 points. You're making space or time in your intake process to ask these kinds of questions so you're prepared when someone comes in. And then what are their needs? Are they coming with someone? What's been helpful in the past? And can you offer support if you don't currently offer it? What's going to be the cost to get you to that point? Next slide. Any questions here for the visit itself?
Kim asked, Will, do you recommend scheduling extra time for all patients with disabilities? First visit or always?
I don't know that I would do a blanket. I would want more information because I think it really depends on what the disability is and how it intersects with what they might need. So they may not need extra time in particular. So for myself, as someone who's blind, I need an elbow to get me to the exam room and so forth. And I would need support in um, getting, I need support outside of the clinic in terms of getting medication. If it's not delivered, then I need to pick it up have it accessible at the doctor's office or at the pharmacy at the hospital. So it's just more convenient for me. But in particular, I don't know that I would need extra time in that sense. So I think it really depends. And that's something in those conversations and having the staff especially who are doing the scheduling, that training, they may not to have those kinds of questions and training in place so that if it seems like someone does need extra time, then they can do that. That's a long answer to your question, Kim, but that's a good question. Did
This
that
is,
answer it?
I believe everyone should have the ability to unmute themselves.
Yeah, I just did. It took me a minute. Thanks. That was helpful.
Okay,
It
good.
really is, once you do the training with with your reception staff, you really have to be able to count on them to engage in a conversation, right? And think through, what does this mean about the appointment?
Yes. Yeah, this is Will. So yeah, it's really important. And I think too, and we'll talk about this at the next workshop as well, when we talk about staff training. Um, we are big proponents of increasing the onboarding training, uh, as especially with staff turnover, that can be very helpful. So you're not continually doing sort of global trainings for everybody. Um, so we're big fans of lots more training up front. Um, yep.
This is, oh, I'm sorry, Will.
Oh, go ahead.
This is India. Um, did we provide, and anyone chime in, did we provide you all with the ADA checklist?
Uh, this is Will. I'm not sure. There were a number of things in the previous presentation, and we can make one of we can have one available by the next workshop if that would be helpful.
Okay, I believe, I'll answer for everyone. I believe it may be helpful. So
Okay.
we'll put together a few resources.
Yep. All right. Should we go on to the next? I think we're in the home stretch here, both time-wise and presentation-wise. So I had some questions for you all, and you don't necessarily have to answer them now, but I think they're good questions. Um, uh, that actually that's relevant to what you just said, India. Sort of what was the and the last when did you last hold a communication tools audit? Like what do you have on hand, and what might you need? So sort of that's something to think about for the clinic, and we can provide some of the materials for that. And then when did you last conduct an accessibility walkthrough? And what we can put together is a sort of checklist style. It won't be like a thorough complete ADA check, because that involves a huge amount of measuring and so forth, but it can provide you with a lot of sort of starting points for looking at the space that you inhabit in your clinic. Next slide, please. All right. So then the diagnosis and care plan. So one of the things here, I think that's probably critical, is understanding that intersection of disability, accessibility, and ongoing care and treatment. And that's key to building sort of an accessible practice. So making sure that the diagnosis is understood and communicated. Do you have readily available resources to aid in explaining a diagnosis that addresses access issues? So for instance, with myself, if I have a wound that I have to do wound care with and it requires a visual assessment of that wound, what are are there other ways to assess that wound, or will I have to have someone come in and look at it for me in order to do that assessment? So questions like that are going to be different depending on your different disabilities. And these could include visual aids, 3D models for some folks, as I mentioned before, or similar. And then, is the care plan understood, and can it be followed? And what are the barriers or potential barriers to following the plan? So it often helps to make that space or time again in your practice to ask those specific questions regarding the care plan and potential barriers to sort of following through with it with an eye towards what those barriers might be. And oftentimes there's sort of transportation barriers or maybe a big one in terms of follow-up care and the care plan. And do you have resources that you can point the patient towards, or do you have a social worker or someone on staff or a partner agency that address the barriers there? Are there any specific access issues related to, like I said, wound care, medication, equipment use, or similar? What are ways those may be addressed? Next slide, please. And then finally is that discharge, the follow-up, and the continuity, sort of very similar, sort of arranging that ongoing care and treatment is important to building that accessible practice. And thinking about if they're going to see another specialist, are they able to get there? What are the tools that they might need or support they might need to get there? And I guess not making the assumption that the next step down the line is going to take care of these access issues. They may not be thinking of them. And so doing some sort of pre-thinking there and supporting the patient can often make for a successful course of treatment. Are there reasonable alternatives that reduce barriers is always something to think about. And again, that space and time questions, transportation, and again, the specific access issues, care and so forth. And then probably finally, and sometimes it can be problematic in terms of the communication and but it's where a portal and other kinds of services, centralized digital services and digital records might be useful, is that the notes and communication to other members of the care team include the specifics needed regarding access, or do they just relate to the medical care? Because if there's only one link in the chain that knows, then whatever it is in terms of access might not be carried out. So that's something to consider as you move forward in building accessible practices. Next slide, please. So in summary, sort of the big takeaways, and sort of there was a spoiler before, so there time and physical space. So thinking about that time issue and how can you build that into a visit, into the care, and then your physical space, whether it's as simple as rearranging furniture to ease movement or replacing doors, installing ramps. And I know some of you are adding specialized sensory rooms or low barrier diagnostics. And then finally, training and communication. And both of those things are pivotal in increasing access. And as we all know, these all intersect with money in a wide variety of ways. And accessibility is always going to be a series of choices. And we'll start to address some of these next time. And here's where we're going to be heading going forward. So staff training, adjustments to workflow, onboarding enhancements, digital tools and portals, checklists, audits, outreach programs, and prioritizing and planning. So any questions? I think we have a few minutes left. Any questions for what we talked about today, or things that you've encountered as India had suggested?
Does anyone have any questions?
None for me.
I have some, I wondered what disabilities are you all seeing in your clinics?
We see a lot of patients with autism, and then we have like a handful who come in wheelchairs, or people with different either injuries. I don't know if this I guess that would be disability, who can't lean down all the way, and so they have to be like kind of sitting up for the entire dental appointment. So it's a little bit difficult on our necks for the appointment. And I'm honestly interested if there's anybody who has any solutions for that one in particular. If people have to kind of just be sitting up, this also applies to pretty much any office that doesn't have the wheelchair like thing that like can lean them back, because for any of our wheelchair patients, we're also basically like we can't get very much further than this. And so it's a lot of difficulty with ergonomics.
Thank you for sharing that. I personally don't have any immediate answers, but there's been a lot of discussion, including earlier this morning, around dental care and IDD and physical disability. And I will make a note and see if I can do a little research around that. Will, do you have any thoughts on that?
On the chair positioning in dental offices.
Yes.
I have a little bit of experience, and I know we're going to have a single training in a workshop in late September, specifically on dental practices. And I can think of one or two things sort of off the top of my head, but I think the kind of supportive adjustable chairs can be useful, but then you also have to consider safe transfers as well. And so that's, another area of training uh, for staff, because that's not something that's probably typically done in terms of dental practice training. So I think there's a couple of different factors there that you would need to. I'll ask. Other than, I don't know of any specific brands or types of equipment that are springing to mind, but I can work with India and we'll try and find something to recommend.
And what's the date in September that you said the dental one was? So I'll block my schedule for the residents.
I think it's the 20, is it the 30th?
I believe it's
29th?
I believe it's the 30th, but I'll double
thank
check.
you.
Sure.
Yeah, it's the last Tuesday in September, I think.
Are there any other thoughts or questions? Okay, it is the 30th.
And then we also have one the first Tuesday, I think, in September.
Correct. Just before we go, one, if you have not completed your Michigan Medicine waiver release form to be recorded, please do so and email that back to me. But are there any things that we can touch on during the next workshop that would be helpful for you to, I guess, immediately enact? Does anyone have a barrier that's occurring or a challenge that's been a recent hot topic in providing services? We'd like to provide something that we can, I guess, low-hanging fruit and a quick win, if anyone has anything like that.
Yeah, this is Will. You can also email India or myself too if there's things, but within the next, during the next 4 weeks as things come up, as you talk with your teams, If there's things you'd like us to touch on, we'd be happy to support you in that.
I think
Absolutely.
you said,
Okay.
so on the 30th will be particularly dental related. Okay,
Yes.
so most
Yep.
of my questions will be probably solved then.
Well, hopefully, or they might just raise more questions.
Thanks.
All right. Well, we appreciate you all joining. Feel free to email me at any time with any questions, and we are diligently working to finalize the funds transfers to you all. Thanks so much.